guys, welcome back to my channel. So the last thing I talked about was how to study for med-surg, and that was right before Hurricane Irma struck Florida, and it was a complete mess. I was without electricity for a few days, but my electricity is back and running and I have AC and everything, so I'm good. Our school got a little bit messed up right now. We've been a week and a few days without school. It's been great, but then bad, because now we're all kind of lost. We were supposed to have our exam this week, and we haven't had lecture. We haven't had, quiz. We're like out of our routine. Some of us still don't have electricity or water. So yeah, it's really bad down here in Florida. They're still picking up all the trees. Thank God for all your prayers. Like, nothing happened to my house, my cousin's house, my friend's house. It's just a lot of trees down on the floor, and my friend completely lost her fence. Like, everything is down to the floor. But yeah, South Miami is gradually getting better. So I'm trying to pick up my routine back again, because like when you're out for vacation a week and then you're trying to study again, it's like this struggle. It's a big struggle. But yeah, I just had my coffee because I need my coffee. I need to be ready to go to study. I was gonna show you guys how I study for one of my lectures, like how I work on it, so you guys could follow me, see how this is my method of studying. Yeah, so I already had my coffee, I had my breakfast. You need to have a good breakfast, because if not, you're gonna be your stomach is gonna be craving weird food, and I'm over here trying to maintain my weight. So yeah, so I'm gonna talk about I'm in peds, so you guys may not be there, or you may have taken the class already, I don't know, but I'm just gonna show you real quick how I do it. So we haven't covered respiratory yet in class, but I did read ahead, and now I'm gonna try to go into cardiac for the cardiovascular disorders for peds, infants. And I'm reading off of the ATI book because our exams are on ATI, which kind of sucks. But I do have the actual course book, but I'm not gonna go into that until I read this book, because this book is to the point. It's easy to understand. There's bullets, so it's easy for the eye, and it doesn't feel overwhelming. But if I don't understand something, I'll go back to the book and just review what I don't know, because I can't waste any more time right now. So yeah, with cardiovascular disorders in infants, I already read through a little bit, as you can see. I already made some notes. I kind of just go through it and just highlight, anything important, because as you can see here, these are what happens to the infant's heart, aortic stenosis, what pons ductus, arteriosus, and then this side are all the symptoms. And majority of cardiac symptoms are all going to be the same. You're going to have the either hypotension, tachycardia, bounding pulse, could lead to heart failure, what else, dizziness, chest pain, things like that. So I try to circle the symptom that's not for each disorder. So let me see, for example, the coarctation of aorta. I'm sorry, I don't know how to pronounce this. But it's when the aorta is constricted, so it's harder to pump the blood to the rest of the body. This one has bounding pulses up on the upper extremities, and then the lower extremities you're gonna see some pale, weak pulses or no pulse. So that's something that stands out for me. So I kind of just highlight it, and I'll do an up arrow and a down arrow to point okay, up, bounding, low, no pulse. Yeah, so that's what I do. And if there's something that I don't understand, I will go back to YouTube and review this Armando guy that I talked about in my last video. I'll show you guys where it is. So hold on, give me a second. All right, let's pretend we are reading, right? Going through the chapters, and this is all of cardiovascular diseases, and you want to fresh up on heart failure because you know all of this is leading to heart failure, so you want to review the patho. So what I do is that I go to my YouTube, I click on myocardial infarction, and it'll be this video. Armando. Yeah, he is great because he draws pictures like as he goes, like explaining everything. Let me see if I could fast forward.
Categories. A temporary loss of blood supply to the heart, and this causes chest pain.
See, like he goes through, you know, all the cells and breaks it down, marks everything.
Stable angina is where we have a stable plaque, and chest pain comes.
So yeah, I'm not gonna watch through the whole video right now because I already saw this, but you guys could watch it on your own time, and it's a great way, you know, to even like watch it a few times so you could be able to explain it to someone else. Alright, so after I watch the disease process, I'm gonna go back to my book and I'm gonna do some flashcards, which I'm like starting right now. But because look, as you can see, like some of them increase blood flow, some of them have obstruction, some of them have mixed blood flow, and then this one decreases pulmonary blood flow. So this is everything that could happen to an infant's heart when they're born. So it's really important that you do some flashcards to help you memorize, you know, what which goes with which. So I already started here, and what I'm going to do is like this one, ventricular defect, atrial septal defect, and pain ductus arteriosus. These all, was it increase? Yes. These all increase blood flow because since there's like a open space, like a hole, so the blood is traveling from like the left to the right side of the heart, so it's like increasing blood flow. Duh. So yeah, so what I'm gonna do is like write this, and then in the back of the card I'm gonna write it increases blood flow. And of course after I do this, I'm gonna review my patho. Hold on, let me just write this down. Pulmonary blood flow. Yeah, so it goes from the left to the right side of the heart because when you learn in peds, like they have different, like 3 different shunts, and they're supposed to close after they're born, but some of them don't. So this is why this could happen. And then there's more. So I'm gonna like go through it and just write them down. And it's good to do this because, you know, like I'm the type of person, if I write things down, I remember. So, and it's a great way to do, you know, like study before a test. So you're just like, like going through it. In the beginning, these were like my quiz. I wrote everything down the first part, and I put like a little tab here so I know like this is for my quiz 1. But now I'm on to quiz 2 because we were supposed to be like almost done with this class. So I don't know what they're going to do with our school since we had the hurricane. But yeah. So I'm going to go through all of this. I'm going to write everything down. And then after I go through that, I'm going to have to go through all the congenital heart defects, which is the same thing. It's these. But I'm going to write it on my notebook paper because then I could, you know, like write everything neat and my way of understanding things. And I'll probably draw some pictures, which I started. Let me see if I could go back to it. Hold on, give me a second. Okay, the heart, and this is the ventricular septal defect. So see how it's going from the left to the right? So that's what's happening. And this one, the aorta is constricted in here. So it's not, your body's not getting, you know, all the oxygenated blood. So a lot of things can happen. So this I started already, so I just didn't want to, you know, like draw in this video, but so that's what I usually do. And then You kind of have to make it fun. See how I'm like doing colors and things? That's what I usually do. The problem is memorizing all the signs and symptoms because there's so many, especially with the heart. So you have to be familiar with what can happen. And it's easy to like remember, but when you see it in a patient, you're like, I don't know. So yeah, make sure you really understand the symptoms. Know what it looks like too. Yeah, so after I write all of this down, there's a lot of meds now that I'm looking at it right now. Like there's digoxin, the ACE inhibitors, all of these. So what I'm gonna do is I'm gonna write all these medications next to the disorders. Like, let's see. No, actually, they don't even have. I think, yeah. No, what I'm gonna do, okay, because these medications are actually for all of them. They don't have like a specific med for like each disorder. So, but on this side for like interventions, I'm gonna write the interventions. See how there's interventions in here? I'm gonna just write it on each of like the disorders. So like they're here. Ventricular septal defects. What I wrote here, it's the opening between the ventricles, and it could lead to right-sided heart failure. And that's pretty obvious because if you're going from the left to the right, everything is gonna be pulling in on like the right side. So it's saying here, for intervention, you're gonna need a cardiac catheterization. So I'm gonna write here in red so I know that that's my intervention. That's what I need to do next. Let me write this down. Cardiac catheterization. Yep. Oh look, see for patent ductus arteriosus in here, there's actually a med. They're talking about a med, indomethacin. So that's important to know because it's specific for that disorder. So I'm gonna write it in here as well. You wanna give that to decrease inflammation. Sorry, I need to charge my phone. See? I write it in red. So I know, like, that's what I'm gonna do. So that's basically what I do for all of it. That's what I'm gonna do. And after I go through my book, I'm gonna go back to my Saunders book and just review what's in here. And pretty much it should say the same thing. Let me go back to it. I'm like legit studying with you guys. Like I'm gonna spend the whole day studying. So let me see if I could find. I need to put a tab on this book because I haven't. It's musculoskeletal, neuro, cardiovascular. There we go. And look, I already did some my highlighting, my reading, and look at, where is it? Look, indomethacin. So that treats inflammation. Am I saying it right? Indomethacin. Okay, I am saying it right, just in case. So yeah, that's what I'm gonna do. I read the book, I take notes, I do my flashcards as I go, and simple, you know, things that you know you're gonna remember, and you just practice, you know, while you're in bed. You just read through it, go through my Saunders book, and then for your notes, make it fun. Draw, Look at my little hearts, you know. Don't make it too complicated. Don't make it look like you're rewriting the whole book. You want to just keep it basic, simple, and read. You want to read and highlight the book. I don't do ebooks. I don't know how to use the internet. I'm terrible at it. So I just like to, you know, read through the book, highlight, use my colors, and yeah, so that's about it. I'm going to continue going through the rest of cardiac because I have so much studying to do. And that is my weekend as a nursing student. You just spend the whole day studying. I wake up, I take my time, I do my me thing. Like, I just painted my nails. I haven't painted my nails in so long. And by the way, it's so beautiful, this nail polish. It's from Essie. It's so pretty. In school, we're not allowed to paint our nails, but since we were out for like a week, I painted my nails, and I'm obsessed with it. I might have to buy another one because I like this color. But yeah, so I do my things first, you know, enjoy your morning, whatever you have to do. Jog a little bit, you know, exercise because it releases endorphins. Endorphins make you happy. Legally Blonde. So yeah, that's what I do, and then I just hit the books and study. I try to, you know, like break it down short on how I'm doing it. I started a little bit ahead before I did this video and before I like talked to you guys, but yeah, these were my vaccine notes, but I already had a test on that. So right now I have to go through cardiac and respiratory. So this is what I will be doing all day. All day. I'm not even halfway done. So hopefully by the end of tomorrow, I should have all of cardiac down. I should be able to know it inside and out, explain it to people because I have my exam coming up. So I have to be ready. And it's almost like in 3 months, it's going to be Christmas time. Like, that's crazy. Time is flying by. But alright everyone, I will keep you guys posted and I'll try to do another video tomorrow. Subscribe below and write to me whatever you want, any questions, I'll talk about it in my video. And I'll keep you guys posted. Bye.